Hey guys, Zane here. So, the question I have for you today, what role does exercise play in improving insulin sensitivity, and what should that workout look like? Okay. Now I know you hear me push food comes first. Food does come first. That's the name of my weight loss group. It is priority. You got to get that in place first, and then make sure you're getting 7 to 9 hours of sleep, because weight loss is about controlling hormones. It's not about burning off calories. It's about controlling hormones and being able to access your fat stores for fuel and not continuing to store more than you burn as a body fat, right? So hormonally, exercise can play a role. So exercise is not about, again, burning off calories, but in improving insulin sensitivity, reversing insulin resistance. And so, not all workouts are the same. Not all workouts are created equal. And some have different goals or different focuses. So I'm not talking about bodybuilding. However, we've all seen athletes, they put on muscle. They work out. They don't look like bodybuilders, do they? So you ladies who are worried about, you think you're going to go to the gym for a month or so and suddenly you're not going to be able to, you're going to start looking kind of masculine. It's not really the case. Not the case at all. And really, it's the best thing you could do for your health. My wife and I are looking at 50s coming up pretty quick. And one thing our doctor told my wife. He's not worried about telling me. He told my wife, the best thing you can do, you need to be putting on muscle right now in your life. You need to be putting on muscle like it's your job. So, because as we get older, it's going to be a lot harder to hang on to that muscle, and active muscle is so vital for keeping insulin sensitivity, okay, for burning off blood sugar and keeping blood sugar low, helping us move better, obviously, but keeping us healthy. And if we can maintain insulin sensitivity, we can maintain our health. Insulin resistance is the baseline for most of the diseases that we are, most of us are medicated for. Many of us are medicated for. The 80% of the lifestyle diseases, okay, that are killing us start with insulin sensitivity or insulin resistance of some form, which leads to, diabetes, heart disease, obesity is statistically linked to 12, 13 types of cancer, Alzheimer's. All of these start with insulin resistance. And so if we can control insulin and improve insulin sensitivity as we age, there's going to be a huge benefit. So diet, sleep, exercise. So what does that look like? Well, with exercise, your goal is to create metabolic stress in that muscle. That means you want to burn off as much glycogen as possible in that muscle. Okay, you want to burn down as much blood sugar that you might have floating through your system. And you really want to feel some fatigue, some real energy turnover. Again, it's not about burning off calories, sounds like it, but it's about creating a response that insulin is going to make your muscles more sensitive to insulin bringing fuel, so we want to keep bringing fuel. Well, it's not going to bring fuel to full muscles. You've got to drain those muscles. You've got to burn off blood sugar so insulin is low. And then when it does come, the muscles are sensitive to it. So first thing, of course, diet. Now, ideally, what I do, I train fasted. So I try to make sure it's a workout day. I don't eat until after I've worked out. Now, if you work out in the evening, that's just how it works with your schedule. Plan several hours before you get to that workout, before you eat. If you eat lunch, stop eating, then you can work out. That's fine. If you're training at 4, 5, 6 o'clock, eat lunch 3 or 4 hours, okay, ideally. Or in the morning, or midday, don't eat until you've worked out. Okay, so that's going to keep your blood sugar low and keep them from being hit by insulin already. Okay, so you're priming them to be more insulin sensitive already. But we want to use large muscles, and we want to use them in repetition. So we want them back to back. We don't need a lot of rest time between sets. We want to use large muscle groups and a lot of pushing, pulling, leg movements, like multi-joint leg movements like squats, lunges, deadlifts. If it's a leg press because you got a back issue, okay, things that use your hip and your knee at the same time. Okay, if that makes sense. So you're moving your hip and your knees. If it's just a single joint, just moving the knee, it's probably not doing a lot. It's not moving as much muscle, but the more joints you have moving, the more muscles you have moving. So pushing, like chest presses, okay, overhead presses, pulls like rows or pull downs, all right, and then the leg movements I mentioned, squats, lunges, leg press, deadlifts. So these are large movements that move a lot of muscle, so they're going to burn off a lot of fuel. They're going to drain a lot of muscles at one time, and this is to make the most of your time. Because I don't know about you, but I don't want to spend 2 hours in the gym. I don't. I work out maybe 4. Sometimes I push it and do 5 workouts a week, weight training, 25, 30 minutes. If I'm there more than 30 minutes, because I'm doing some high intensity cardio afterwards, and that's like another 5 or 6 minutes. So, but really with the weight training, 30 minutes, you can get something done. And be on your way, because we're all busy, right? We're all busy. Time is precious. Do them in a circuit, restricted circuit. So not restricted circuit. So do it in a circuit where you push, immediately go to the pull, and then go to your leg movement. Now, if you want to throw in some ab work in there, you want to throw in some planks, some leg lifts, some crunches of some sort, throw that so you have a 4th exercise, that's fine. But your big movers, pushing, pulling, leg movements. Now, I know we've all seen this guy, but you don't want to be this guy. Don't be the guy who's there doing a set at 10, 30-second set, 10 curls, and then he sits on the bench for 2 minutes. And he's looking at his watch, he's looking at his phone, he's kind of whatever. And then he gets up and does another 30-second set of curls, single joint, just working probably one of the smallest muscles in his body, right? One muscle. And then he sits there for 2 minutes. Meanwhile, his not fat shaming, but his stomach's hanging over his belt. And he's spending the majority of his time trying to work this little muscle. I mean, really, is that the best use of time? Is that productive? Okay? Is that really helping him with his health and maybe what his goal should be is getting into shape? Okay? Obvious answer, no. Okay, single joint, sit and rest. You're spending more time resting than you're working out. Why are you there? Get out of the way, right? Tell that guy, get out of the way. I'm trying to get something done, okay? Keep moving. Heart rate should be up. Push, pull, lunge. I have put people, working professionals, some a little overweight, some a little bit older, 60s, 70s, through 25 to 30 sets of exercise in a circuit in 30 minutes. So averaging close to 1 exercise a minute. Okay, of anywhere from 10 to 15 reps. You can do it. Keep moving. Now, it may take you some time to work up to that, especially if let's face it, if you're a couch potato or you're not working out much, yeah, ease into it. Ease into it. Start moving slowly. Maybe start with just, 6 different exercises that you go through a couple times. And you get that done in 20, 25 minutes. Work up to, 3 exercises, 3 sets each. You do that three different circuits. So 9 exercises, 3 times 2, 27 sets of exercise. Push for 30 minutes. You want to supplement that with a little cardio afterwards to burn down some extra fuel? That's fine. But you start with your strength training. You want to work to fatigue. You want to feel the muscle, like on that last set, you should be barely able to finish it. You should feel some lactic acid in that muscle. That's called metabolic stress. You want to feel that burning sensation of lactic acid building up. That's because you're burning down glycogen. Okay? This is creating the hormonal response we want. This is improving your insulin sensitivity, which is going to help you with preventing so many lifestyle diseases if you can improve insulin sensitivity and keep your blood sugar down all the time, right? Active muscle. It helps you move, but it also helps you maintain healthy blood sugar levels. So I know this, if this is new for you, changing the concept from burning calories to improving insulin sensitivity, hey, ask me some questions. Post them in the comments below. Happy to answer them. But you want to take this mindset when you go in there. You're trying to get as much work done in as short a period as possible. 1, for your time. 2, because it increases the intensity and the level of fatigue and the amount of energy turnover you're creating in a short period of time. So that you give the more fatigue on that muscle, more energy turnover you have, the greater your sensitivity will be to insulin when it comes around. Because if you're having trouble losing weight and a weight seems to be sticking to you, and I'm not talking about the last 5 pounds, I'm talking about if you're 20 pounds or more overweight and no matter what you do, it seems to like stick, it's not working, you may have some level of insulin resistance. And the best way to combat that, as I said, start with your diet, go low carb, get enough sleep, 7 to 9 hours of sleep, because that affects hormones as well, and get some level of strength training in 2 or 3 times a week. And those 3 things in that order will improve your insulin sensitivity and get you back in control of, get that hormone under control, insulin, your management of that hormone, of your insulin sensitivity under control, and get your weight back under control where you can start making some progress. So again, if you have any questions, please comment below. I'm happy to answer them. I'll talk to you later.